We are testing channel 5. Testing, testing. Check 1, 2. Thank you.
That's okay.
Okay, stand by for the countdown.
Thank you and good morning. Welcome to the Public Health Kickoff Month Activities 2024. The City of Springfield has celebrated Public Health Month since 1996, with the exception of 2 years when we were in the pandemic, 20 and 21. So this city has really taken public health as one of our core foundations as we work together to achieve a healthier community. Throughout the month, you will notice in your program books there are activities that agencies and organizations do throughout the month. Now, nationally, they celebrate Public Health Week, but this city decided we need the whole month to really highlight all the good work that's being done in the city of Springfield. We dedicate this year's Public Health Kickoff to Ms. Mabel Sharif. Her leadership in the public health arena is well known, not only in the city of Springfield, the Commonwealth of Massachusetts, but everywhere she went. Her motto, "I am who I serve," really speaks to Mabel Sharif, a true community champion for public health. I'm going to ask Brenda Evans to come up and say a few words about Mabel Sharif. They served together many years on the Public Health Kickoff Committee. Brenda?
Thank you, Commissioner. Good morning, everyone. Miss Mabel, what can I say? She was a true dedicated public health servant, a community servant, and she loved Public Health Month. She started participating in Public Health Month, I believe, in the mid-90s. We served on the Luminary Committee, subcommittee for many, many years, up until up until the pandemic. 2019 was the last time she was the chair and I was part of the committee. And she is missed by many of us. She was a mother figure to me and a mentor. And I would like to acknowledge her children and grandson that is here this morning. If you all could please stand. Thank you all for coming.
Mabel Sharif leaves a legacy of love, a legacy of caring. When Susan Taylor wrote, "God has not called us to be powerless spectators, but to become powerful initiators." We are spiritual beings and we have the power to change the dynamics that's fueling a very dangerous world We can create harmony in our lives and in the world. It's not only possible, it's why we are here. Mabel Sharif lived that. She felt very strongly that she could make a difference in this world, and she did. She leaves a legacy that is so rich and so powerful. We'd like to give these flowers to a member of Mabel Sharif's family. If you would come up, please. We'd like to give you these flowers from us in memory of Mabel Sharif. If you'd like to say a few words, we're happy for you to do that.
I'll just make it short. I appreciate the support from my mother. May she rest in peace. And that's all for now. You'll probably see me in other events later on this year.
Thank you. Thank you for being here.
Thank you.
Now we are going to have our opening prayer. We are going to have two individuals come up, Deacon Mr. Luis Alberto Reyes and Dr. Mark E. Flowers. Deacon Reyes graduated from Westfield State University and achieved 2 master's degrees, one in public administration with a concentration in criminal justice and a master's certification in Spanish. He retired to deploy to Afghanistan, and he has worked as a substance use counselor at Gandara in Springfield for over a decade. He is currently working for the Hampden County Sheriff's Department as a counselor and correction officer. And he says, I enjoy attending church, spending time with family, and playing the guitar. Dr. Mark E. Flowers is the senior pastor of Mount Calvary Baptist Church in Springfield, Massachusetts. Under his leadership, Mount Calvary has grown to be a church with 3 Bible study fellowships and several strategically effective kingdom-centered ministries. Dr. Flowers was formerly the pastor of Corinth Baptist Church in Mount Vernon, New York. He has facilitated workshops and seminars in such areas as sacred choral music. A native of Mount Vernon, New York, Dr. Flowers studied business management at Howard University, graduated from Concordia College with a bachelor's degree in music and education. He received his Master of Divinity and Doctor of Ministry from New York Theological Seminary. Dr. Flowers is married to contemporary abstract artist Renee T. Woodward Flowers, and they are the proud parents of a daughter, Radiance Ruby, and a son, Solomon David. Please welcome Dr. Mark Flowers and Deacon Reyes.
Good morning. Let us pray. Great sovereign God, our peace and our strength, we call to our focus before you all whom it is easy to forget, homeless, destitute, sick, isolated, the newborn, the seasoned, the violent, and all who have no one to care for them. We firmly believe that your holistic dunamis power is manifested effectively through the work of your called community mosaic represented in this room today. In this defining hour, we affirm your authority and call on our lives by saying thank you. Thank you for protecting, connecting, and thriving deep inside of us, deep down in the citadel of our soul, the core of our belief system, that it would expand and develop into our united commitment to being public health and our capacity to protect, connect to, and with our beloved Springfield community. That we may celebrate this community, a community now thriving. Touch the hearts of all who serve human life in medicine and science, so they will protect the dignity of each person from conception to natural death, and remain faithful advocates of all those entrusted to their care. Greatness, you are already here in this room. We connect with you through the award recipient honors, the words of Dr. Hernandez, the kindness and smiles of all of us at this peaceful gathering. Continue to give us strength to be bold and joyful witnesses to the truth that all human life is valued and is sacred. God, beyond our understanding, you are welcomed here. Amen.
First, I want to thank God for giving me the blessing of being here today. Around everybody here, most of the people here I know worked together for decades, a long time ago, and I'm so grateful that they're here. And let's bow our heads and pray. I'm going to pray in Spanish. Amantísimo Dios y Padre Celestial, primeramente gracias por esta oportunidad que tú nos has dado estar aquí compartiendo lo que es la salud pública, Padre Santo, y servicios humanos, Padre Santo. Conociendo, Padre Santo, que las personas que están aquí están aportando, Padre Santo, a las personas que son vulnerables en la comunidad, especialmente eso que la sociedad ha olvidado, Padre Santo. Pero yo te pido que tú lo sigas bendiciendo, lo sigas fortaleciendo para que vaya llevando este mensaje no solamente a nuestras comunidades, pero a donde quiera que se paren, Señor. Esto te pido, Padre Santo. Te pido también, Padre Santo, que bendigas mucho a mi amigo y hermano, Dr. Hernandez, que sigue llevando también el programa de rehabilitación y de recuperación a las comunidades, y no solo aquí en la ciudad de Massachusetts, sino también en toda la nación, Padre Santo. Te pido por los recipientes, Padre Santo, que van a ser otorgados, que por favor los sigas bendiciendo y que continúen llevando este mensaje. Te pido esto en el nombre de Jesucristo, tu Hijo amado, que murió por nosotros en la cruz del Calvario. Amén. Amén.
Thank you. We get an opportunity once again to celebrate one of our former Luminary Award winners, Mrs. Frances Hubbard. Many of you probably remember Mrs. Hubbard. She was also a public health force in our city. I'm going to ask Z. Johnson to come forward and read a poem that Mrs. Hubbard wrote called Who Are We? Z?
Good morning, everyone. So in keeping with the spirit of our theme this month, we all are public health, I'm honored to read a poem created by Frances Borden Hubbard, who was a true pioneer in countless social change movements, including education, prison rights, women's rights, workers, refugees, socioeconomic, civil, and religious rights. So as an additional note, Ms. Hubbard received the Springfield Public Health Month Luminary Award in 2000 and the Massachusetts Department of Public Health Frontline Award in 2008. So at this cultural moment, we pay tribute to Miss Hubbard and to us. Her poem is called, Who Are We? Who are we? Who are we today? We are powerful. We are gathered healing circles, invincible. Who are we? Angels. We are angels, messengers creating futures, spreading joy, life-giving sentinels. Who are we? Not you, not me, but we. Carrying angels, spreading joy, guaranteeing life, protecting streams and air. Who are we? We're custodians, we're protectors, we protect water, streams, and each other. Linked and free, breathing air collectively, learning to secure our trees, beaches, hills, parks, and our children running free. Who are we? Angels who dare together, circling lives everywhere. No, we are here, singing angels, planting seeds, uprooting despair, singing our songs, weaving wreaths, tying love bows, hanging tinsel flowers, lighting candles, spreading light, filled with hope everywhere. Who are we? Hearts transplanted, fueling choruses, building precious sentiment into hope everywhere. Who are we? We are sun rays spreading down into the universe, temple fabric of life filled, jostling doubt, removing hate. We are pledging comfort for each aching heart, one by one, comfort for each lonely soul, love for each person on this earth. We erase eerie, strange incantations. We splash laughter across the skies. We build unity and peace. Who are we? We are you. We are me. We carry angels building peace. I thank Ms. Hubbard for her presence in Springfield, and I'm sure she will be proud of who are we. Amen, amen, amen.
Thank you very much, Z. Well done. Who are we? I get an opportunity every year to present awards to individuals in our community who have had a public health impact. And this year, the Commissioner's Award is very special because this young woman is very special. She is the founder and leader of Heart to Heart Lactation Wellness. Her work around breastfeeding is well known across the city and across the state. She has co-chaired the Child Maternal Health Commission for many years, and she always does it with a smile and a pleasant personality. She currently works in Mayor Sarno's administration, one of the foundations that picks up the phone and responds to the public. She is a mayoral aide. She is a mother. She is a daughter. She, for me, is an inspiration. Ms. Chanel Ford. want to come in a bit? Okay.
Yeah. She had no idea.
And so it says, City of Springfield, Department of Health and Human Services 2024 Commissioner's Award presented to Chanel Ford in recognition of your outstanding contributions to the City of Springfield in promoting public health.
Oh my goodness. I'm just at a loss for words. Thank you. Thank you. To hear those words from someone that I idolize and who is such a phenomenal force of nature, especially as it relates to public health. This is heart work for me. This is passion work. I'm a girl of this community, and to be able to serve my community in this capacity is something that I don't take for granted.
It's okay. It's okay.
I don't do this work for gratification, for accolades. I do it for the families that deserve to be heard, the families that deserve to know that they have options. And I'm just grateful to be able to stand in the gap and advocate for them and remind them of their power. So this is so unexpected. I get so excited about public health every year because I live it every single day. And to know that especially on today, we're honoring Miss Mabel, who was another phenomenal force of nature. This is all, it's everything. So, thank you.
That's why I kept telling him. I kept telling him, I just said, make sure, I want you to be there today. Chanel, they want to get a photo shoot.
Oh, and now I'm all teary.
Okay. Do you need a tissue at all?
I do.
You're good? Okay.
Our next award is the Public Health Luminary Award, and you heard about two of them, Mrs. Mabel Sharif and also Frances Borden Hubbard. Our first luminary was Dr. Jeffrey Scavron in 1997. I see Richard Johnson, who is also a Luminary Award winner. Maria Ligas, also a Luminary Award winner. Am I missing anyone who is here who received a Luminary Award? So you can see that there are some really fantastic and special people who are received this award who are doing great work in our city. And that leads me to the recipient of today's award, Sarita Hudson. Let me just tell you a little bit about her. I will tell you that she received more than one individual who nominated her. So her work really is something that has transcended many people, and she is the Senior Director of Strategy and Programs at the Public Health Institute of Western Mass. Sarita leads coalition building, the coalition building team at the Public Health Institute of Western Mass. Her responsibilities include managing several programs and coalition, resource development, planning, program development, and organizational communication. She currently directs the Healthy Air Network of Pioneer Valley Asthma Coalition, the Springfield Homes Collaborative, and the 413 Cares Online Community Resource Database Initiative. I have known Sarita for many years, and her work around the Asthma Coalition, how she advocates for healthy homes in the city of Springfield and probably the region, is well known. I recall Sarita coming to the Public Health Council, doing a presentation for us and making sure that foundationally we had the information we needed to be able to support all of the good work that the coalition is doing. So Sarita, it is with pleasure that the mayor and I are able to give you the Luminary Award. I'm going to ask the Luminary Award committee just to stand so that you can see. I know Brenda Evans is here, who chaired the Luminary committee. So I want, beg your pardon? Who? Rob Crawford chaired. Mr. Crawford said, don't be taking my chairmanship from me. Thank you, Mr. Crawford, and thank you, Teresa. That's right. And so, Sarita, if you'd come up, Mayor Sarno. Thank you so much. And so we do have a proclamation for you that the mayor will read. However, this says, and once again, every year we give this award, and it is the highest tribute that we in public health in the city of Springfield can pay to an individual. City of Springfield Department of Health and Human Services Public Health Luminary Award presented to Sarita Hudson.
The podium is yours.
Again, it's a loss for words. What I do want to say is the work that I do is all about collaboration, and I want to thank all of the people that I have collaborated with, because what I do is only possible through the wonderful people I work with. My colleagues at the Public Health Institute, I've seen some around here, the city department heads who work with us, all of the city staff involved, our partners at Revitalize CDC and other community organizations. The only reason that we can do the work that we do through the Asthma Coalition or Healthy Air or through Healthy Homes is because we have such amazing people and organizations in Springfield. And so I feel like all I'm doing is pulling you all together, and it's all about the amazing people here and the amazing community. So thank you so much.
Good morning, everyone, and I hope everybody had a joyous Easter, too, and good health to you and your families. First of all, let's give a big round of applause to the elegant and eloquent, so you had a little drum roll for you there, Commissioner of Health and Human Services, Helen Caulton Harris. Sarita, I have a proclamation for you. I'm not going to go through the whole thing. Put my cheaters on here. We'll just go to the last here. And thank you, Focus Springfield, for videotaping this, too. We appreciate that. So let's go as here. Whereas Sarita is an exemplary employee, fierce advocate and leader in public health in Western Massachusetts, with experience in issues including environmental health, climate action, resiliency, sexual violence prevention, women's rights, social justice. You're like the Renaissance woman. Sarita continues to advocate tirelessly on building community capacity, amplifying community voices, ensuring growth, development, diversification in the PHI staff, board of directors, programs, coalitions across the spectrum. And whereas today we join with Sarita Houston's family, friends, and co-workers in acknowledging her 25-plus years of dedicated and committed service to our community in the health care field, as she is recognized as the 2024 Luminary Award recipient during the City of Springfield's 28th Annual Public Health Month ceremony. Therefore, I, Dominic J. Sarno, Mayor of the City of Springfield, do hereby proclaim Monday, April 1st, and it's not April Fool's either, 2024, as Sarita Hudson Day in the great city of Springfield. And I encourage all our residents not only to be aware of this event, but to thank her for her dedicated efforts. And I hand wrote here, thank you, congrats, good health, and God bless. Helen, did you want me to do? Okay. I'm not gonna do it. Okay, thank you very much.
So on your program, you saw where the mayor usually does the proclamation to open up Public Health Month for us, and I'm going to ask him to do that at this time.
Thank you very much, Helen. First of all, to all the award winners and to my mayoral aide and assistant, sweetheart, Chanel Ford, congratulations. I must have said to her 30 times, make sure you're at the Public Health Month. I like to have you there, maybe take some photo shots. So well deserved. This was much of a surprise for her, and she is so dedicated to her cause, and she just does an outstanding job, not only for myself and the city of Springfield, but for the residents and business community of the city of Springfield. So Chanel, congratulations again. Beautiful family. Her mother is the songstress of the city of Springfield, Vanessa Ford, and she has two great young men, two sons who always frequent my office. They're so respectful. So Chanel, congratulations on that. Sarita, congratulations, well deserved. Both you two are very much alike because you never go out looking for the spotlights. You do a lot of things behind the scenes, and your reward is when those families you help, whether it's tomorrow, whether it's 10 years from now, say, hey, you were there when I needed you and you helped me out. So congratulations to you both. To Mabel Sharif, as she looks down upon us from heaven with that $1 million smile, even though she's not here, her legacy lives on, and Mabel was a dear, dear friend, not only to myself, but my wife, Carla, and again, she was a fierce advocate when it came to public health. I'm also joined by my friends and colleagues in government. City Councilor Maria Perez is here. Maria, thank you for being here. And my running mate on the school committee, Barbara Gresham, is here too. Barbara. If I missed anyone, it's a mistake of the mind and not of the heart. I want to go a little bit into the elegant and eloquent Commissioner of Health and Human Services, Helen Caulton Harris, and to her deputies, Deputy Kissel and Deputy Barber also. But Helen has been in the forefront of public health for many, many years. And probably she's a pension award winner, but probably behind the scenes before the COVID worldwide 19 pandemic hit, which really showed how important public health is to each and every one of us in a proactive, preventative way. She was my point person for a year and a half. We stood here, Helen, Dr. Kerouac from Bay State, Dr. Roos from Mercy, myself, and our cabinet heads and other reportees, and we did it a year and a half every Monday. We did it every morning, but every Monday. And we still run into people that say to us they miss us from across Western Massachusetts. That's how they got their updates. And Helen and I would say, well, we didn't miss doing it. I'll tell you that right now. And I also want to thank Reverend Flowers and Deacon Reyes. Thank you. You know, prayer is very important. And a little prayer never hurt any one of us. And if we had a little more prayer in this city, in this state, in this country, in this world, it would be a better place. So thank you, gentlemen, for being here. Honored. So, public health before that pandemic, though extremely important, was an afterthought. Okay, you know, they inspect restaurants. There were a myriad of things that touch each and every one of us in our public. And to the public health warriors that are out there on the streets day in and day out, not looking for any type of accolades, I commend you because you're able to turn people's lives around. Whether young or old, when people have lost their way. And if you don't feel good, you can't do good things because you're struggling. It's difficult for you to provide for yourself, your family, and your community. And you are able to give them the ability to find the right direction. And also, again, on preventative and being proactive, your efforts in caring and health centers, I don't know if it'll ever happen, but hopefully it'll stop clogging up all our emergency rooms. But if it wasn't for your efforts, our emergency rooms would be clogged up even more. So I want to give each and every one of you a big round of applause. And thanks. So with that, we have an official proclamation. City of Springfield, Massachusetts, Mayor Dominic J. Sarno, home of the Basketball Hall of Fame. Proclamation, whereas communities around the state have observed National Public Health Month each April to celebrate the role of public health prevention services in protecting and improving our city's health. Over the past 28 years, we have seen a tremendous success by working together across diverse fields of public health. I also want to say there's been some issues where we did the right thing, and when it came up, Helen will tell you they might have been controversial. But we moved forward on public health and science and medicine, and now for the naysayers that said you shouldn't do this, you shouldn't do that, now everybody's on board on some of the issues that we've been able to move forward. The goal of the Springfield Public Health Month is to recognize the contributions of public health to uplift the health of the Springfield residents. And whereas public health professionals help us prevent, prepare for, mitigate, recover from impact of full range of health threats, we continue to stress prevention by teaching people how to promote their health and the health of their families. We continue to be supportive in our investments in proven community-based prevention programs to save lives and money. We respect each person as an individual without judgment, using every means possible to promote health and strengthen families. Whereas public health is part of our everyday lives, from the water we drink to the air we breathe, the provision of fresh, wholesome, nutritious food, the safety of our parks and streets, to the laws that protect us from injury, the vaccines which help us stay healthy and alive as we've experienced navigating the COVID-19 worldwide pandemic. And whereas we wish to acknowledge and we wish to encourage public health workers to celebrate the gains made and continue to aggressively create the changes that make for a healthier community, we strive to create a culture of health in our city that is committed to equity. We're therefore wish to recognize the month of April 2024 as the 28th annual Springfield Public Health Month, with the theme being protecting, connecting, thriving. We are all public health. Therefore, I, Dominic J. Sarno, Mayor of the City of Springfield, do hereby proclaim the month of April 2024 as Public Health Month in the great city of Springfield. And I strongly encourage all our citizens to take notice of this event and make sure that they encourage their families, friends, neighbors, co-workers, and leaders to learn more about public health and its positive impact on our community. Each and every one of you, I thank you. God bless you. I wish you good health, and God bless. Thank you so much.
Oh, you want the proclamation? If you had any role in this year's Public Health Month celebration, I'm going to ask you to come up so that you can also receive this proclamation.
Okay. Come on up.
Okay,
Don't be bashful. Come on.
Teresa, Chris Mary's there.
Come on up.
We're just going to take a quick picture.
No, come on. Come on. I put my deodorant on today. I got you smiling now. Yes. Carroll Street, yeah. Hey, Z. Nice pull. Come on up. Come on, everybody. Everybody into the pool. Come on. Okay. We got spots.
Okay, here we go. Wait a minute, let me, oh, is it here?
Get my good side. I'll turn around. I'm smiling.
Thank you.
Thank you, everybody. Thank you, Helen. Thank you.
We have another treat for you. We have a talented singer and songwriter, Blue de Bay Figueroa. He's talented and he's a songwriter. He's 22 years old and music is his passion. He also has a love for health sciences and recently received his CNA certification. He's a member of the Young Adult Gambling Project that is investigating gambling behaviors, perception, and knowledge of Springfield adults ages 18 to 24, a project of the Springfield Department of Health and Human Services in partnership with New North Citizens Council and the UMass Center for Community Health Equity, Evaluation, and Research. Please welcome Blue.
How everyone doing? Give us a second, y'all. It's on? Okay. Oh. I'm a little tall, so bear with me. Every Sunday, same seat, front row view, Bible on my bedside table, and if you ask, I'll pray for you. I've played every part of who I'm supposed to be. My head and my heart, they sometimes disagree. The honest to God truth is that I fall apart and sometimes hope feels a little too far. I can't always find the light in the dark. If I'm honest to God, honest to God. If we're honest to God, honest to God. Hide my heartache, pray they don't see through. Always told to stay face, stay safe. But what would Jesus do? I've got all the answers to question everything. I've got a place, but it's not convincing me. Honest to God, truth is that I fall apart, and that sometimes hope feels a little too far. I can't always find the light in the dark. If I'm honest to God, honest to God, be honest to God, truth is I've seen every side. When I've done it all wrong, if I'm doing all right, I'll never understand why He doesn't change His mind. If I'm honest to God, honest to God. Disagree. Yeah, sometimes they disagree. He's not waiting for perfect. He meets us in between. The honest to God truth is that we fall apart, and that sometimes hope feels a little too far. I can't always find the light in the dark. If I'm honest to God, honest to God. Be honest to God, truth is He's seen every side. When I've done it all wrong, if I'm doing it all right, I'll never understand why He doesn't change His mind. Honest to God, honest to God. If we're honest to God, honest to God. If I'm honest to God, honest to God. I'm nervous. Thank you. Thank you.
Can we give our 22-year-old songwriter and public health activist another round of applause? Thank you. Next, we are going to have our keynote, and it is a blessing to have Dr. Hernandez in our community. He brings with him so much knowledge, and he keeps it real. Whenever I have heard him speak, he tells it like it is, not like it should be. And so I value and appreciate that about him. Dr. Hernandez is from Puerto Rico, fluent in Spanish and English, and lives in Massachusetts. With more than 36 years of expertise in planning, implementing, and evaluating substance use disorder, mental health, HIV/AIDS, HCV, problem gambling, and related services. Dr. Hernandez leads with a social justice lens and approach grounded in eliminating disparities and building health equity. As a public health professional with expertise in the determinants of health, SDOH approach, coupled with implementing multiple strategies over multiple domains. Dr. Hernandez also believes that quality public health work cannot be accomplished without true partnerships and engagement with people with lived and living experiences, their families, and formal and meaningful relationships with community-based organizations and institutions. Dr. Hernandez's resume of lived experience as well as living experience he documents. He has a long bio, and I just read the first paragraph, but that first paragraph was certainly impressive and speaks to his work in public health. Please welcome Dr. Hernandez.
Many thanks. Buenos días. Todavía es mañana, ¿eh? ¿Nos vamos en el español? ¿Sí? Good morning. And so a few things. To the recipients of the awards, congratulations, felicidades. It's great to be in good company. Muchas felicidades. To the planning committee, and to whoever nominated me, thank you. You might get into some trouble after I say some words. Commissioner, thank you for the wonderful introduction and for not reading the entire bio. If you saw me get up, I saw she had the page and I said, no, just read this. And Dr. Teresa Glenn, thank you for the communication and again for the invite to come and present. So there's a few things that I want to get to, and hopefully you'll be able to see some slides. Is that going to be the case? Yes? Oh, there we go. Thanks to the brothers who, I was told that this would start at 9. It felt like a party at my house. In mi familia, they tell you at 9, you arrive at 10, it starts at 11, por ahí vamos. So I arrived at 8:30, and I've been sitting on that bench for a minute. And those of you who are just thinking, well, that's a bench. For some of us, that bench brings back some memories. I've been a little bit under the weather. So, Hernandez, I am Chief of Public Health at the New North Citizens Council, and I want to acknowledge and thank Maria Ligues, the Executive Director, and our team who's here, who do really good work day in and day out at the community level with very little fanfare. And I also want to thank everyone else who's in the audience who does really good work as well. And we are as strong as our ties to the collective. I was introduced as Dr. Hernandez. I'm a certified prevention specialist. I am a certified and licensed addictions counselor at the reciprocal level, and I have a PhD. And I also have a GED, and my GED I earned in prison. And it was more difficult to earn a GED in prison than a PhD out here. I am a person in long-term recovery, which for me means that I haven't used a drug, including alcohol, for the last 37 years and 3 months. Now, some people, muchas gracias. Some people threw dirt on me and said I wouldn't live to see the age of 18. We have a tendency of proving people wrong around here. For me, being in recovery allows me to be a productive member of my familia, my community, and to be present here today. So I come from that perspective. Many people don't know that my PhD is in public health, actually. So I'm going to talk a little bit of history around public health. I'm going to highlight a couple of pressing matters, and then I'm going to talk about our responsibilities as the collective, our responsibilities to move public health forward. 100 years ago, 30% of all children died. 100 years ago, 30% of all children died. Think if you have kids, grandchildren, babies, think about what that means. 100 years is not a long time. Right? In the last 30 years, we've gained 30 years of life expectancy. Let's put in this room life expectancy at 70. How many of you are older than 40? You would not be alive today. You would not be alive today because life expectancy was at 40. So the midlife crisis that they claim would happen at what age? At 20. That gives perspective in terms of what public health has done for us. Most of these advances have been made possible by sound policy, development and implementation, not necessarily medications. In other words, 25 of those years were made possible because of policy. Only 5 because of new medications. Okay? Only 5 because of new medications. 25 because of policy. Think about what those policies were and continue to be in place today. Clean drinking water, sewage, all of those things that make our lives healthier and better. Evidence-based prevention has been at the center of that. Prevention has been at the center of it because we're able to prevent disease, injury, and other public health issues. We don't have monuments to public health. We don't have monuments to public health. We have monuments to individuals. Further, forwarding the myth of me, the all-powerful, which is a load of crap. We have monuments to war. We have monuments to things that have contributed to killing people. We don't have monuments to public health that has saved millions and millions of lives. Public health has been termed the invisible shield. How many of you have seen the recent PBS documentary on public health? Couple of hands. To the rest of you, I encourage you to go and look at it. Really well done. When public health is working well, we don't get sick, get injured, or die before our time. When public health is working well, none of those things happen. Now, we might get sick, but because of public health, we're able to stay healthy. When prevention works, nothing happens. Think about that. When prevention works, nothing happens. And we're used to what? To being alarmists when something goes wrong. But when something goes well, think about what that looks like, right? Due to this reality, we don't understand public health and we undervalue it. How many of you were in a car accident this morning coming in? Nobody, right? That's public health. How many of you, well, let's stay with that one for a moment, right? So why was that? Because we have street lights and stop signs, and some of you were cursing at the street light saying, this damn thing doesn't change. Or you went through a yellow light, violating public health measures that were put into place to keep us healthy. If you did get into an accident, which no one here did, your seatbelt would have saved your life. Airbags would have saved your life. All of that stuff is public health. The stuff that we take for granted. And some of us get in our cars and don't want to put on a seatbelt and have all sorts of attitudes, beliefs, and behaviors that run counterproductive to the gains that we have made in the last 100 years. Right? Now, what do we regulate and monitor? All drugs, including medications, maternal child health, housing, running water, sewage waste, air quality, traffic safety, vaccines, mortality and morbidity, safety, cars, planes, and other forms of transportation, food monitoring and recalls. Imagine when you've been around for a minute, some of you have, some of you are really young. But you've been around when there's a recall on a type of food. That's public health working to our benefit, right? And there are others. There are other things that we do in terms of public health. Yet, many people don't understand public health. They can't explain public health. And they think about it as the series of things that we do here, there, and elsewhere that are independent from one another. Nothing could be further from the truth. This is about the collective. This is about the collective. Approximately 40 years ago, the U.S. began to move away from public health as a series of policies that drive healthy behaviors and life expectancy, and started to lead with what you need to do is take personal responsibility and pull yourself up by the bootstraps. That mentality is a flawed mentality. No one can pull themselves up by the bootstraps. And no one has done anything by themselves. And when you see people in the media pat themselves on the back and say, I am self-made, that is a load of crap. It is a load of crap. And if you believe that you're self-made, I'm going to ask you a series of questions. Who bathed you? Who fed you? Who taught you how to walk? Who taught you how to read and write? Who taught you how to do math? Who taught you, who taught you, who taught you, who taught you? And for me, those are thousands of people that you don't see behind me right now. And many of those people are in this room in terms of supports that help us move forward. That is about the collective. But about 40 years ago, Ronald Reagan started this. And that's not me talking. It's in the public record. It's in the literature. As a result of all of that, we live 3 to 5 years less. 3 to 5 years less. As a result of those policies, which are alive and well today, the U.S. has spent $3.6 trillion on public health, and less than 3% of that is on prevention. Now we know that prevention drives public health. So why are we spending most of the money on public health on other things and not prevention? If you have kids, and many of you do, and we have kids in the room right now, do you want them to have a bed at a mental health facility or a substance use disorder facility when they need it, or you want them to never need it? I want my kids, from my family, from my community, to never need that. So I embrace prevention, right? Between 2016 and 2018, we begin to experience another wave of losing years in life expectancy. Due to what? Opioid overdoses, heart disease, obesity, and the list goes on. You know what all of those things have in common? That they're preventable. That they are preventable if we would emphasize prevention in public health. Most of the money that we spend is not on prevention. Never forget that we have a for-profit healthcare system in the U.S. We are one of a couple developed countries where still people are profiting from healthcare. This is disgusting in what we claim to be the most powerful country in the world. And those healthcare settings have a not-for-profit status, which means what? That they don't pay taxes. Puñeta. All of these issues can be prevented. All of them. So in terms of the approach, what should be the approach? We need to pay attention to disparities because disparities exist, to the definition of disparities, particular type of health difference that is closely linked with socioeconomic and or environmental disadvantage. Pay attention to those highlighted areas. Health disparities adversely affect groups of people who have systemically, emphasis on systemically, experienced greater obstacles to health based on what? Race, ethnicity, age, gender, socioeconomic status, and all of those other characteristics. Disparities have been institutionalized systemically, utilizing a racist and deficiency framework that has been purposeful. Disparities have been developing on this continent and in this country since its inception and the arrival of Europeans. Poor people didn't create poverty, hungry people didn't create hunger, unemployed people didn't create unemployment. People experiencing homelessness didn't create homelessness. Yet we act, behave, believe in blaming people for miseries that they did not create. And we go about behaving like that and blaming people for those miseries. Led by what? If I did it, anybody can do it. Load of crock of shit. And people want me to tell the story, if I got a PhD, anybody can get a PhD. Listen, I don't discount anybody's ability in this room to get a PhD. But I do know that that system wasn't developed for most of us. I do know that that system has a whole bunch of roadblocks to make it impossible for the majority of us to get in. That is not because our people don't want to get in. It is because of a system that was designed a very particular way. And we have a responsibility to understand it in a critical way and not to perpetuate the myth of individual greatness. So, I'm going to highlight a few things that I think are pertinent in public health. I wish we had the time and I would highlight a whole bunch of other things, but a few things here. The rate of violent crime per 100,000 rose in Massachusetts from 301 persons killed in 2001 to 322 in the year 2022. Springfield saw its largest jump from 14 homicides in 2022 to 31 last year. Many of us have been in those funerals. Many of us know the moms, the daughters, the sisters. Many of us knew the people who died, right? So for many of us, this isn't an exercise in intellectualizing what people are suffering from on a daily basis. Easy access to guns, including ghost guns, drives the crime epidemic in the U.S. Now, some people don't want to deal with that. And the NRA is a powerful institution in this country that will go against anyone who talks about gun control in any form. Now, we live in Massachusetts, and we have a series of laws that are halfway decent. But still, the availability of these guns is out of control. Now, most people have been taught to think this way. If we want to deal with this situation, all you need to do, you at the individual level, is stop buying guns. Stop hanging out with people who have guns. Stop at the individual level. And so we go back to the pull yourself up by the bootstraps mentality and blaming people for conditions that they did not create. Aside from Smith & Wesson, who else produces long guns here in Springfield? There are factories that produce these things legally, and they make their way into our neighborhoods. How do you think that happens? When we can detect a nickel from space with powerful telescopes, we can see into other universes. But we can't detect what's coming in and what's going out, or do we profit from that misery? That is a different understanding of what's going on for people. And here's what we don't want to pay attention to. The structural determinants of health drive actions at the individual level. What are the structural determinants of health? Employment, housing, neighborhood conditions, health access and quality of care, institutionalized racism. Healthy people living in healthy neighborhoods don't have needs to kill each other. If you have never shot anybody, take it from someone who has. Desperation will make you do a lot of things. Living in conditions that are less than humane makes you do and drives us to do very serious things. Another issue area, opioid overdoses. The U.S. declared a public health emergency in October of 2017. Why do you think that was? Read the next bullet. Young, white, affluent kids began to die at alarming rates. And all of a sudden, we have a public health emergency. But between 1999 and present day, over 1 million people have died. And where was the outcry way back then? Oh, because those people look different. You see? Those people were primarily people of color. African American, Black, Native American, Hispanic, Latino, Latina, and it is okay for those people to die. And that might sound harsh, but the evidence is before us. We can stick our heads in the sand and say, that's not true, Hanir. You're being a conspiracy theorist, or we can look at the data and the evidence. And that doesn't lie. If your head right now is pushing back on what I'm saying, good. Deal with that. Because my people have been dying for a very long time. I buried my sister, my aunt, 3 cousins, and a whole bunch of other people that I know. And so have you. So have you. Take a look at this. In 2017, Massachusetts was celebrating a 8.3% decrease in opioid overdoses, and then after that, 4% decreases. The governor came out, the Secretary of Health and Human Services, the Public Health Commissioner, they all came out patting themselves on the back, saying, oh yeah, we have control over this. We're one of 5 states where this isn't happening. We're bringing it down. And some of us in the audience who wear a disparities lens said, wait a minute, that doesn't sound right. In my community, people are dropping left and right. So what the hell is it that you're talking about? When we took a look at that data, in that same period of time, opioid overdoses went up by 83% for African American and Black people. 100% for Hispanic, Latino, Latina folk. So it begs the question, is getting better for whom? If you thought that the public health crisis is because young white kids are dying, and you took all of our tax dollars and put them into those communities, of course their numbers are going to go down. But what happens to us? We continue to get prisons and jails. That's what we continue to get. And I refuse to keep quiet about that, regardless of the consequences. Third issue, mass incarceration. Near and dear to my heart. In 1970, there were 200,000 people incarcerated in the U.S. Fast forward to today, 2.3 million people. This is the largest prison population per capita in the world. This is the time to chant, USA number one, USA number one. The largest prison population per capita in the world. This is what we do. 5 to 6 million people on probation, parole, house arrest. We released every year, 7 million people from county jails. At the federal level and state prisons, we release approximately 600,000 people every year. That's almost 8 million people that we release every year with very little to no support. within a year's time, 75% of those 8 million people are going to get rearrested. And about 50% of them are going to do time again. The reentry into our communities looks like this. Not a supportive reentry. And I know that some of our folk who are in the room work to support people who are doing reentry. I know that you do that. But I'm talking about our system as a whole. Policies that drive mass incarceration. I don't have a lot of time left, but I'm going to ask for a couple of people to say one or two things, just one or two words, not a whole speech, about a policy that you think drives mass incarceration. Anybody, yell it out. School to prison pipeline. In the literature, think about how young kids are treated within schools. Black and brown kids are suspended, penalized at a greater clip than their white counterparts for the same infractions. It's now being called the cradle to prison pipeline. Someone else with a different policy. Let me start it on marijuana. Dios mío. So, Massachusetts has recreational as well as medicinal marijuana. Upwards of $5 billion have been profited from selling the same marijuana that I was selling back in the day. And by the way, I still have a criminal offender record that includes possession of marijuana. Now, who's profiting? Those dispensaries that are all over the place, walking distance from here, right? Who owns them? Primarily, white heterosexual males. Because people like us, people like me, are not allowed to play in that arena. Because the laws were written in a very specific way. There are 30,000 people in the U.S. still doing time, as we speak, for selling the same marijuana that is now being sold legally, while the federal government is looking the other way. 2/3 of them are people of color. 2/3 of them are people of color. Deinstitutionalization, then President Kennedy, 1960. Let's close down all state mental institutions. That happened. People were not returned to community. Many of those people ended up in prisons and jails. The war on drugs, Tricky Dick, Nixon, 1970. We're going to go after people who possess drugs, who use drugs, and we're going to incarcerate them. The criminalization of behavior. Brother Gardner in New York, who was choked to death by the New York City police. What was he doing? Selling loosies. At some point, that wasn't illegal. But the Rockefeller laws, broken windows policies, stop and frisk, all of that stuff that exists in our communities. Have you ever been stopped and your pants brought down? Some of us have, because we've been around for a minute. And because we live in certain neighborhoods, I grew up in the 01107, and I still live there. Powder versus crack cocaine, 5, 10, 15, 20, 30 years for small amounts of crack cocaine, devastating black and African American communities, while people with large amounts of powder got off. The sentencing disparities were 100-1. Obama brought it down to 18-1, but still there are disparities in that sentencing, right? Mandatory minimums, 5, 10, 15, 20 years behind the wall without the right to probation, parole, or anything else. And when you leave, you're kicked out abruptly with very little supportive services. No voting rights. Massachusetts, we can vote if we have a criminal offender record like the one that I have with felonies on it, but upwards of 20 states in the union will not allow us to vote. Why? Because they're afraid of what people incarcerated would do if they have the right to vote, and who would they vote for? It is that, nothing else. School zones, 2 years of mandatory time attached to your sentence. Springfield, about 1,000 feet is not a school zone. Everything else is a school zone. 3 strikes and you're out. There's a guy in Texas doing life in prison for stealing 2 slices of pizza. There's a guy in California doing life in prison. He broke into a soup kitchen, was hungry. Have a friend sentenced to life, habitual criminal, for stealing a car. And there's thousands of those cases. Massive prison construction. We're talking about hundreds of billions of dollars. You don't go from 200,000 people incarcerated to 2.3 million without building prisons. Think about who gets money from that. Construction companies, the people who produce the materials, the people who build those spaces and places, the folks who work within prisons and jails. Where are they located? For the most part, prisons and jails in the country and here in Massachusetts are located in white, affluent neighborhoods, and the people who work within them are primarily white, and those jobs come with really good salaries and retirement accounts and benefits and health care for life. You think it's in their interest to close down prisons and jails? Of course not. Because what we have done is we privatize prisons and jails. If you're sitting in this room and you have a 401k or 403b, which I hope you do, and a retirement account, you probably have money in prisons and jails and you don't know it because they're traded on the New York Stock Exchange. It's not just health care for profit. It is prisons and jails for profit. There's an incentive to keep people locked up. This is the elephant in the room. The bow on this cake is criminal offender records. What do they prohibit people from doing? Getting a job, housing, getting your kids back if they were taken by the system. They make it more difficult for you to be a productive member of society. That's what that does. Doesn't end there. I wish it did. All federal cases, 97% are pled out. At the state level, 94% of all cases are pled out. Imagine if the 3 of us were sitting in a bullpen waiting to be sentenced. Teresa's probably asking, so why are we in the bullpen, Annette? Here's the reason why we're in the bullpen. Because we are poor and we don't have money for bail. This system incarcerates primarily poor people. So our lawyer would come to the back, and that lawyer is a public defender. Why? Because we're poor, and that person has 150 to 200 people on their caseload. Teresa, this is your 3rd offense. They want 25 to life. Are you willing to take 20? They want 20. Are you willing to take 15? They want 15. Are you willing to take 10? They want 10. Are you willing to take 5? They want 5. Are you willing to take 2? They want 2. Are you willing to take 1? The majority of us are going to say yes. Why? Because we know that that prosecutor out there is an elected official who's primarily concerned with not being viewed and soft on crime and wants to get reelected. This is what is passed off as due process in the country. For all we like to talk about, the greatest legal system in the world. Really? For who? Because that for me is always the question. For whom are you talking about? It was just like the drop in opioid overdoses, right? Who are you talking about? Because you're not talking about that for us. Is this a broken system? Raise your hand if you think that this is a broken system. Well, respectfully, I'm going to disagree with you. This system is not broken. It works exactly the way it was designed to work. I just gave you a whole bunch of policies. Those things work exactly the way that they were designed to work. Policies didn't fall from the sky. We elected officials. We supported them. I remember the 80s and 90s when all this stuff was going on. If we think that this is a broken system, we're going to tinker around the edges. If we acknowledge it as a system that works exactly the way it was designed, then we need to dismantle it. Not tinker around the edges. Not tinker around the edges. This is why some people don't like me. Because I'm not that person who comes, we need to do reform. Reform for who? Who are you talking about? What is it that you're talking about? In Massachusetts, a couple of years ago, they were working on a bill. That bill was around criminal justice reform. Solitary confinement. We are the only country in the world that still does solitary confinement. Every other developed country views it as torture, But we still have it here. 5, 10, 15, 20, 25 years in the hole. It's a prison within a prison. Some of us have been in the hole. We know what that looks like, what that feels like, and what that does to us physically, psychologically, and to our relationships with other beings. That bill, there was a group of people who said, in terms of the reform of solitary confinement, we're going to leave it up to DOC, the Department of Corrections, to define what that looks like. The other group of us said, hell no, we should define it in the law. Guess who won out? Not you, losers. You won out in that bill. So we left it up to DOC. You know what DOC did? They changed the name of solitary confinement to something else. That was the reform. You follow what I'm saying? There has to be accountability. We need to think about doing things differently. Yet the governor signed it, and people applauded. And some of us sitting in the audience said, this is bullshit. This is the same thing over and over and over and over again. Just as an example. I have a couple of slides left. So what are we charged to do? We're charged with building equity. Building equity. How many of you have seen this depiction before? All right, most people have. Let's see if you've seen it in this version of it. Far left, equality. Far left, equality. 3 people, different heights, all get the same box. Question to you, rhetorical. Do you think equality exists? Equality only exists in the minds of people with power and privilege. Those are the people who say, if I did it, anybody can do it. Because no one starts from the same place. So I'm going to bring you to the far right. Reality. Now, the smallest person is in a ditch. They're not trying to dig a hole under the fence to get to the other side of the fence. Some people are relegated to a ditch even before they're born. There's such a thing as generational poverty. Right? For those of us who like to go around telling people, if you work hard enough, you're going to make it out of that because I made it. Shut up. Shut up. I know people who work 3 and 4 jobs. They work harder than I do, and they will never make in a month what I make in an hour, and that's not me bragging about how much money I make. That's me pointing out the deficiencies in that statement, that if you work hard enough, you're going to make it out of that. If it was hard work alone, and I believe in hard work, every single female on the face of this planet, in Africa, Asia, Europe, the Americas, would be a multi-billionaire if it was hard work alone. The person in the middle, what did they get? Just that same tired box, enough to see over the fence. And then the person who didn't need a box to begin with now has 7 boxes. And we think about the millionaire class and the billionaire class who we go around glorifying because they create jobs and wealth. Bullshit. They don't create wealth. The poor people create wealth. Poor people create wealth. Working people create wealth. These people own the wealth. Less than 1% of the world's population owns 99% of the wealth. Those are inequities that we need to deal with. Then I bring you to the middle. Equity, right? Hands are up in the air. The smallest person now can see. The person in the middle for the first time is looking sideways to the other person. The tallest person, fists up in the air, and we have equity, right? This is where we need to go towards. Another crock of shit. This is not equity. Maybe this is the version that you haven't seen. This is not equity. Why isn't it equity? Because what we just said is the problem is that person is too small. And that person who's small doesn't have control over their height. We just blame the person for the misery that they did not create. If you didn't see the fence, that is the problem. If you didn't see the fence, that is the problem. The fence, not the people. If you ask these three people, where do you want to watch the ball game from? They will say, I want to sit in the bleachers with the right to pay $1,000 for that stinky hot dogs and $2,000 for the beer. But I want to be treated with dignity and respect, not from the outside looking in. And so this is an exercise in critical thinking. How many of you saw the fence as the problem? Some of us didn't see the fence, and I'm not calling you out because when I first saw this exercise, I didn't see the fence either. But I have a really good mentor who told me, Helen, that's a crock. Don't you see the fence? And I went, oh, espérate. You're right. What does the fence represent? All of those policies and procedures that keep people in and some people out. All of the policies and procedures that allow some people to get health care and others not to get health care. The policies and procedures that I presented earlier around mass incarceration, that's the fence. And if we don't work on the fence, we're going to repeat, because what we do in this instance is that we chase boxes. I chase boxes. Someone needs a detox, they can't get in, they call me. I know the clinical supervisor at the detox facility. I call them, I can get them a bed, and yay, the person got the bed. Am I supposed to feel good about that? No. You know why? They shouldn't need me to get in. They shouldn't need me to get in. What happens when you call a detox? Call back in 2 hours, call back in 2 hours, call back in 2 hours, call back in 2 hours. If you have health insurance, you're sitting in this room. If you have health insurance, you're sitting in this room, and you become sick, and you call your doctor's office, they don't say call back in 2 hours, call back in 2 hours, call back in 2 hours. And when we ask those folks, why are you having people call back in 2 hours? We're trying to measure motivation. That is disgusting. That is disgusting. So yeah, I'm pissed. Because we have individual and collective responsibilities to speak truth to power, regardless of who's in the room or who left the room. Final slide. Pay attention to the imagery here. We work really hard to pull some people out of the rivers of substance use disorders, mental health challenges, poverty, homelessness, incarceration, etc. Notice the pigmentation of the skin of the people that I'm talking about and the fact that they're on a boat. Historically, racialized people have had no choice but to do for ourselves, and we have. This time, there is no boat. Look at the pigmentation of the skin of the people that I'm talking about. And then there's what? There are those people who are intentionally left behind because of the profits that are to be extracted from trauma, poverty, and unhealthy people. Because as we speak, people who have a lot of money are making more money off of the fact that people are incarcerated, in jails, that people are sick, and all of that stuff. That is a reality that we have to contend with. I'm going to come back full circle to public health and quote Desmond Tutu, who said, we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in to begin with. This is the call for prevention. This is the call for dealing with the structural determinants of health. This is a call for us to stop putting Band-Aids on gushing wounds. This is a call for not just thinking about restorative justice, and we should, and criminal justice reform, but rethinking new ways of doing things and embracing public health, because public health has taught us the power of what we can do. And I would be remiss if I don't mention this. Remember that slide that I started off with? We gained 30 years of life expectancy in the last 100 years, just know that that wasn't everybody. That wasn't everybody. Some people in our communities have lower life expectancies depending on zip code. And if you don't believe that, all you need to do is visit a Native American reservation. And I'm not talking about the ones with the casinos. There are plenty of Native American reservations in this country, and some of them don't have running water or electricity. And when the COVID pandemic was happening, the government was sending them body bags and not the equipment that they needed to prevent COVID from ravaging their people. Just like we sent them and gave them, this country did, blankets laced with smallpox. Just like we did with Tuskegee and sterilization of women and everything else that has happened in this country in the name of democracy and freedom. Then I question democracy and freedom for who and at what cost? What are we called to do? We are called to humanize our people. We are called to embrace our people. We are called to lift up the voices of our people. Not just individuals, but the collective voice of people within communities. People talk about us like we don't know what the hell we're talking about. People talk about us like we need to come in and save you. I don't need for you to save me about anything. I need for you to treat me with respect. I want to thank you very much for listening to me this morning. And once again, congratulations to the recipients.
As I said when I introduced Dr. Hernandez, he keeps it real. He tells us what we need to hear. Want to say thank you once again. Thank you. We're going to have our closing prayer, and then we're going to do our raffle. Now, you know the most exciting part of today is the raffle, right? Other than Dr. Hernandez, of course. But we're going to have our closing prayer, and then we're going to do the raffle.
Wow, I was introduced as the pastor of Mount Calvary, but another thing I do is I'm the professor of African American religion and religion in America at Springfield College. And over the years, students have developed a working definition for what religion is. And they said that religion is a human quest for the divine and how that is effectuated in community, sacred writings, and how people interact and relate to each other. And so in this human quest for the divine, benediction in like a Judeo-Christian religious context typically means the utterance or bestowing of a blessing upon people who are exiting a gathering like this. The universal context for this mosaic requires that we bestow wellness upon all that have gathered, that the overflow of this benediction discourse will generate an emerging splash of good health and wellness on the citizenry of Greater Springfield. So listen, in respect for a creative, out-of-the-box type of benediction, I ask now that you would just be still. That you would close your eyes and become aware of your body in the chair. and feel the ground under your feet and even the air touching your nostrils. Be aware of your nostrils breathing in air and listen to the gentle sound of your breathing. Breathe in slowly and breathe out slowly. Breathe in slowly and hold it and just think of the peace in this room. Breathe out wellness for the person that's on your right. Inhale slowly. Wellness for the person in front of you. Breathe out wellness for the person that's behind you. Breathe in wellness for the person on your left. Keep your eyes closed and imagine an eagle gliding through the air. Imagine white clouds moving slowly against a blue sky. Imagine a well, newborn baby cuddled in the arms of a loving adult. Imagine a wheelie-popping teen hopping off their bike to help a seasoned widow dressed in black crossing a busy main street during lunch. Imagine the sails of a boat being blown by the wind. And as the deer panteth for the water, my soul desires nothing but the best for all of you. May the peace that transcends our cognitive ability be in you, on you, around you, with you, forever, eternally. Amen.
Quería decir primero, ¿verdad? Gracias a todos por venir aquí hoy, ¿verdad? Es un honor que todos estén aquí, agradeciendo mucho a muchos compañeros que veo aquí, a la doctora Hernandez, porque si él lo mantiene en realidad, mantiene la realidad, porque nosotros somos fruto, aquí hay muchos que somos fruto de la colaboración de muchas agencias aquí, por eso es que estamos aquí parados. Yo llevo en recuperación over 33 years, hay 30 años, y esto lo he logrado por salud pública, que nos ha ayudado a nosotros estar firmes con el apoyo que todos tenemos. Si no tenemos ese apoyo, no vamos a llegar a nada. Primeramente hay que poner a Dios por delante para que podamos seguir hacia adelante. Vamos a inclinar nuestro rostro y orar. Amantísimo Dios y Padre Celestial, te damos las gracias, Padre Santo, por esta actividad, Padre Santo, que hemos podido participar. Te doy las gracias por todos los que están aquí presentes, Señor. Te pido que tú lo sigas fortaleciendo para que sigan llevando este mensaje, no solamente aquí en el área de Springfield, pero a donde quiera que ellos vayan. No solamente tiene que ser aquí, también puede ser para nuestros familiares, Señor, que puedan entender que sin colaboración no podemos llegar a nada, que la salud pública somos todos, no solamente la agencia, sino todos nosotros que estamos aquí vivos, gracias a ti, Padre Santo. Yo te pido que lo sigas bendiciendo y que esto siga llevándose a cabo todos los años, que podamos seguir ayudando a las personas, los más necesitados, Padre Santo, que la sociedad nos ha separado, Padre Santo. Yo te pido en el nombre tuyo, Padre Santo, que tú nos sigas dando la fortaleza para llevar a cabo esta misión que nos ha mandado. Esto te lo pedimos en el nombre del Padre, del Hijo y del Espíritu Santo. Amén. Amén, gloria a Dios.
Thank you, Deacon Reyes and Dr. Flowers, Reverend Dr. Flowers. Thank you both for being here, taking the time to make sure that we had our foundation as we started and closing us in words of prayer and spiritual uplifting. Thank you both so much. This ends the formal part of our program. We're going to, if you have your raffle tickets. So we have a Wahlburgers $25 gift certificate first, and that is 462129. 462129. Yes, that is it. Thank you.
Thank you so much.
Red Rose Pizzeria restaurant $25 gift certificate. And that is 426085. 426085. 462, I'm sorry. All right, thank you very much. YMCA of Greater Springfield, 1 month membership. 462090. AC Produce, $25 gift certificate. 462123. Do you want to do them both together? To give them the 215? Okay. Mexicano Restaurant, $30 gift certificate. And the number is 462082. 082. Stop and Shop, $50 gift certificate, which is 2 $25 gift certificates. Stop and Shop. 462081. Better Life Whole Foods, $50 gift certificate. And the number is 462088. 462088. Thank you. Sabores, is that correct? Yes. Sabores Mexican Restaurant, $50 gift certificate, which will come in 5 $10 gift certificates, but it is $50. And 462117. Thank you. Now, this is one of my favorites. Did I get a ticket? This is one of my favorite restaurants. It is Juquentos Healthy Grab and Go Juice Bar. 2 $25 gift certificates for $50, and the number is 462093. $462, that's probably mine. Give me my ticket. So somebody give my ticket so I can, but the number is 462093. Is that person here? Otherwise, I'm moving on. Okay, I'm moving on. 462093, not here. Brenda, do you have a ticket? Brenda, do you have a ticket? You don't? Okay, all right. All right, let's move on then. The two $25 gift certificates are up again, 462089. I love that. Have you been there? No, that's okay, because I don't want to be selfish. Anyway, but no, if you haven't been there, you should go. It is amazing. Okay, and it's right down the street from you too, right? Best Fitness Gym 1-year membership and 4 free personal training sessions. All right. 462087. Yeah. Okay, Olive Tree Books and Voices Book Basket. We want to thank Z. Johnson, who is the owner. Here we go, 462135. I think that is the end of our gift baskets. There are some amazing lunches back there for you, so please have a box lunch, which is donated by Sodexo, right? Correct. So they have been donated, so please take a box lunch with you.